placed it in his pocket, and Allah subhanahu wa ta'ala knows best. I asked my husband for a face wash, which he didn't get, and I swore upon Allah subhanahu wa ta'ala that I wouldn't talk to him. Do I have to give kafara? Basically, sister, this is quite a sensitive question, because obedience to your husband is compulsory. It's obligatory in Islam. The Prophet ﷺ said in a hadith, لو كنت آمرا أحدا أن يسجد لأحد لأمرت الزوجة أن تسجد للزوج. The Prophet ﷺ explicitly said in this narration, if I was to ask anyone to prostrate in front of anyone, then I would have directed the wife to prostrate in front of the husband. Now this is a general hadith of the Prophet ﷺ, tradition of the Prophet ﷺ, that reflects obedience to the husband in everything, only if it has to do with something against Allah subhanahu wa ta'ala. In the disobedience of Allah subhanahu wa ta'ala, then you don't have to obey him. But in this case now, you asked him to get you a face wash.
tonsillitis, by the way. Allergic reactions can give you swollen tonsils, all right? So if your child has fever and has swollen tonsils, it's likely to be an infectious process. If there is no fever, but they have these swollen tonsils and they're pretty, stable child, well, it could be an allergic reaction that needs to be investigated further.
Okay, so Khadiza, hapo umeuliza hilo swali, unaambiwa na daktari kwamba inaweza kuwa kwamba ni allergic reaction ya mtoto wako, ndio maana 1 month down the line hajapona, kwa hiyo mpeleke hospitali akaangaliwe na uangalie kama ana fever vile vile. Treatment, daktari, treatment of tonsillitis, what does it involve?
Well, it depends on what's causing the infection. If it's a viral infection, we usually give supportive care. That means we reduce the fever. If the child has is vomiting, we deal with that. If the child is having poor feeding, we don't do much for viral tonsillitis unless it's a treatable virus. Okay, most viruses are not treated; they go away on their own. They're self-limiting. If it's bacterial, if we have investigated and we found out that this is a bacterial infection, we need to give antibiotics to treat that. If it's other causes, we treat based on what's causing the disease.
Okay, so kwa yule mzazi pale, kawaida watu tunasema kuhusu treatment, lakini umeuliza je, treatment yake itakuwa ni nini? Hapo chini umeuliza Khadiza, ukienda kwa daktari, nafikiri ndio hivyo daktari ameweza kutuelezea, utapewa antibiotics vile vile za kuweza kutreat. What other throat infections, daktari, are there that can actually be contracted by children?
Well, children can have, as we said, they can have viral infection of the throat. They can have bacterial infection. Sometimes children can develop a pus, collection of pus in the, around the tonsils or in the throat, behind the throat. So all those, yes. Okay. Some bacterial infections can cause a collection of pus in the throat, which is really a serious, condition. They develop fever, they are unable to feed, they have a lot of, drooling and all those kind of things. So it's always good when your child has, unless they are quite stable, they're not having fever, and it's just a bit of discomfort of the throat. It's better to be seen by a doctor, because there are certain infections that occur in the throat which, if not treated, can proceed and cause damage in other vital organs in the body, like the heart and the kidneys.
Like what infections are these, for example?
Some bacterial infections can cause infections of the throat, and then if not well treated, can proceed and cause heart problems, which can damage your heart. It can also proceed and cause damage of the kidneys. Condition called rheumatic heart disease, and and kidney disease as well.
Okay, and how are these infections transmitted from child to child? Most of the questions that came to me from the mothers I was speaking to is like, when my child has a cold, then the other person will also will also cough, and then the younger one will also cough, and then and everybody will get a cold somehow. How are these infections transmitted?
That's a common occurrence when you have many children. That's a problem that you will encounter. So what usually happens is that usually children interact quite a lot. They play together.
Yes.
So when a child who is having an infection of the throat is coughing, will discharge those infectious products. Then another child will inhale. Okay. That's one way of transmitting. The other way is when children usually touch each other, kiss each other, play, with each other. So they end up, coming into contact with those secretions that we talked about. And then, they either use, they use those hands to eat without washing. They can use those hands, those infected hands, rub those hands against their face, their mouth, So that's how they end up now transmitting to each other.
Now that's from children to children. How about in the family setup? Because yesterday, one of the ladies, one of the mothers, alini text akauliza, cups and plates and spoons, the way children like to share, we encourage them to share. So you drink from daddy's cup or mommy's cup or your sibling's cup. Can that transfer infection to you?
Yes. If they are contaminated with saliva or secretions that have infectious products, yes, of course they will.
And what other means in the family setup back at home?
Surfaces, sharing utensils that have effective, products, and as well as, of course, when people are living in the same environment, in enclosed environment, and one person coughs, those particles end up in the air, and so it's easy for other people to inhale and get infected. So it's a common actually problem. Usually adults transmit these infections to children. They pick it from outside and they come home, they kiss the children, they cough inside the house and without covering their mouths, and perhaps afterwards not without washing their hands. So that's a reality actually in our homes.
Yeah, there's a question about that, but before we come to this question, let's take our first break on this particular episode. When we come back, we'll come and talk about, some of the practices that can be practiced. There's a teacher who's actually sent a question. Mtazamaji, kumbuka, unatizama kipindi Healthy Thursday, tunaangalia common infections ambazo zina affect watoto wetu. Na sasa pia kuna swali kuhusiana na the rainy season is here with us. What are the infections that we are probably expecting as parents to get to see in our children, and what practices can we teach our children and also us as parents so that we can prevent our children from getting these common infections? Remember, you can tune in on YouTube or also watch us or also on your TV, or rather you can join us on our social media platforms on Facebook, Instagram and Twitter is at Horizontv Kenya. See you in a short while. Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show.
Horizon TV, the beacon for the nation.
Healthy Thursday is not just about diseases. It's about food, lifestyle, milestones in the medical practitioner's field, especially in our Muslim Ummah, and more so, your health. Discover breakthroughs and milestones in the medical field. Learn how to manage diseases.
That was not painful.
Join the discussion. Make better decisions on your meal plans. Improve your lifestyle.
All the doctors who are there were tired of working in maternity and taking care of women. And they say, you are the new kid on the block. We are leaving this department to you.
Healthy Thursday is about you, about your family, your lifestyle. So keep it locked Horizon TV on Healthy Thursday with me, Mariam Mwacharo.
Horizon TV, the beacon for the nation.
Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show. Shukran sana kwa kuendelea kutegea the premier Islamic TV station Horizon TV mtazamaji. Leo ikiwa ni Healthy Thursday, tunaangazia masuala yako ya afya, na leo tunataka tukusaidie mama, baba, dada, mkubwa, kwa watoto wale wadogo, kwa sababu hivi sasa kuna mvua ambazo zimetabiriwa kuendelea. Tunataka tukusaidie, je, ni infections gani ambazo watoto wanaweza kupata nyakati hizi za mvua, ama zile common ambazo huwa wanaweza kupata, na je tunawezaje kuwafundisha watoto kuweza kumudu afya yao wao wenyewe kwa wenyewe, ili wapate kutusaidia angalau na haya magonjwa na sisi tusipate kukurubiana nayo na kupambana nayo. Hususan masuala ya afya huwa mara nyingi huwa yako ghali sana kushughulikia, hasa kwa watoto. Kina mama jana waliweza kuniambia, daktari, Kuna mwalimu hapa ametuma question, anasema mimi ni mwalimu wa kindergarten. And as you know, kindergarten kids, they play and touch each other and roll on each other, fall on each other, and they really do not know anything about, you know, hygiene and cleanliness. As a teacher in kindergarten, how can I help my children, you know, prevent themselves from infectious diseases, as you're talking of them in the studio, Daktari?
Well, infection control for children starts long before they go to school.
Oh.
Yes.
Okay.
It starts with, actually starts from birth. Breastfeeding is an infection prevention, you know, technique.
Okay.
A child who's done exclusive breastfeeding is protected from a lot of infections. Infections of the chest, infections of the gut, ear infections. Because parents transmit those protective, you know, immune products to their children.
So we should start with parents first.
Yes, yes, yes. Let's start from there.
Okay.
I'll come to the teacher. So the second thing is vaccinations. Vaccinate these children. Of course, by the time they go to school, they must have done, you know, most vaccines, isn't it?
Yeah.
So when these children are vaccinated, they're likely to be protected from these infections. So at home, they need to be taught hand washing, you know, techniques. They need to be taught when to wash their hands, okay, how to wash them. That needs to be done. So when they come to school, now the teachers have to enforce those, you know, habits, hand washing, you know. I would assume if a child is coughing and has fever, they don't need to be in school. They need to be treated, isn't it? They're sick, isn't it?
Yeah.
So a child who's coughing, and of course what she said is true, children, you know, interact more and you know, get quite close to each other, play. A child who has fever, who's coughing, I think needs to be at home until they get better. They need to be treated before they're sent to school. But while at school, the teachers need to teach them to how to wash their hands. Well, prevent these children from infections by safe handling of food, you know, avoid, you know, contaminated food. Of course, when children play in stagnant water, they drink that water, they can get infection of the gut, they can have diarrhea and such kind of things. So there are a lot of things that teachers can do, but most of these things need to be done prior to admission to school. Yes.
Okay.
Breastfeeding, feeding them well so that they can be protected from these viruses, okay?
Yeah.
And vaccinate them before they go to school. Once at school now, teachers need to now teach them how to wash their hands, how to handle each other, how to, you know, avoid contaminated water and food and such kind of things.
Yeah, and we talk about proper hand washing techniques every single time. But Dr. if you can just show us, you know, just how do you properly wash your hands? Because, you know, there's, and then bus, and then there's you know, on the tap. So just show us, how do you properly, you know, if I'm teaching, you know, my child or my little sister or brother how to properly wash their hands, how do you do that?
Well, you need to wash your hands from all surfaces. Okay? You pour water into your water, you get soap. Usually use water and soap.
Okay.
So you wash this surface first. Okay?
The palms inside.
The palms, yes. Then fingers
in between.
In between. Wash from this side. Wash from here as well. Okay? Now, okay, wash the tips, yeah, the nails, okay, the thumbs.
Oh.
Yes.
Okay.
Yes. Then you wash the entire hand now.
Okay.
Yes.
And how long should that take? You know, can you just...
At least 15 seconds. At least 15 seconds.
15 seconds.
At least 15
okay, so daktari hapo ametoka kutuonyesha proper hand washing technique. Unatia mikono yako maji, baada ya kutia mikono maji una rub sabuni, unaosha hapa ndani kwanza, alafu vidole hivi unapishana, alafu hivi juu,
okay,
unapishana, alafu kucha, unaosha, kisha na thumbs, alafu sasa ndio unamaliza hivi, unasuza mikono yako. After that you wipe on your...
No, use a towel, you know, dry towel to not your clothes. Of course, now you contaminate yourself again, and then you have to do it again.
You know, if you don't mention it, some people, you know, they just finish.
Dry. You know, you dry with a clean dry towel.
So say for example, it's a child who's going to school. they should have a clean two handkerchiefs for the nose and for drying their hands?
No, schools should be able to provide those napkins that you can't use those things those ones that they keep in them in their pockets.
The ones in the pockets after
yes,
you remove your lollipop and then you.
Oh yeah, okay. So the school has to now provide, those clean napkins that people use to dry their hands.
Okay, I guess hiyo ni challenge pia kwa shule zetu, manake mimi
because when you have water and you have soap, you have to have
you must have something to dry.
Yes.
Well, mimi sikumbuki nikienda shuleni kama nilikuwa na towel pale washroom unless sikuiona, but yes, that is a challenge to our schools to actually provide napkins so that they can, dry hands after washing. Now, the common cold, this is something we've heard of so many times. Daktari, what is a common cold? Let's start there. What's a cold?
Well, that's a layman term. A common cold means infection that occurs in the upper respiratory tract, which has a cough, runny nose, fever. They are mostly caused by viruses, and they're usually self-limiting. They might not require any medical treatment.
Okay.
Yes.
They don't require any medical treatment?
Not really.
So what are the symptoms of a common cold? Because I do understand, Pia.
Unless, of course, there's fever, yes. Yeah, of course, that one might, if a baby has a fever, has a common cold, you might give something for the fever. But I mean, you might not require to give antibiotics or any other sophisticated medications.
Okay. So what are the symptoms that a mother can look at when, and tell that, my child has a cold and it's not something else?
They usually have mild fever, small fever. They might have a cough. They might have a runny nose. All right. Yeah, those kind of symptoms are most common.
And after that, what measures should you take so that because you say most of the time it does not require medical treatment. So what measures should a mother take? Well,
at home, they need to hydrate these children very well. Hydrate them well, let them drink plenty of liquids.
Plenty of, okay,
yes.
Not water necessarily?
Not necessarily water, warm liquids. That means uji, warm
tea,
water,
coffee.
tea, and those kind of things.
Okay.
Well, I don't advocate for coffee in children. Okay, so that's one thing. Feed them well as well. When they are fed well, their immune system is capable of protecting themselves. If they are febrile, we talked earlier, if they have fever, reduce their clothing, the layers of clothes they are wearing. Honey works well for common cold. Can be given warm water with honey. Basically, those are home remedies that they can apply. And if they don't get well after 2 days, they still have high fevers, they need to be checked.
Okay, yeah, a question that came since yesterday when I posted this, there were some parents who were asking us, despite everything, why are we usually recommended that children sleep a lot when they have a cold instead of getting hyperactive as they usually are? Why do doctors say they should sleep? Or
they
rest?
Should sleep?
Yeah, or rest.
Well, they should rest, of course. They rest. Of course, a sick child needs to rest to conserve some energy, to fight infection. Well, there's no specific recommendation to keep them asleep all the time. I don't think so. They need to be fed well, of course. They need to rest, yes, to get better. Well, and they need to be hydrated well. Those are key. Remedies. Those are key, things to do. Well, of course, sometimes they might seem weak, fatigued. Those are the symptoms of viral infection. You might have a joint pain, weakness, dizziness. Those things come with the viral infections.
Okay, just before we take the second break, how can we equip our children with the knowledge of caring for themselves? What practices can we teach them at home? And related to that, there's a question. What kind of practices can we teach our children at home?
The key thing to teach children is proper hand washing technique.
Just that?
Yes. Then you consolidate that. Whenever when they're using the toilet, before, after, before they eat food, after they eat food, when they're handling food, before and after, all those times children need to learn how to wash their hands.
Okay.
Of course, children are not like adults. they tend to forget these things. So what needs to be done is to reinforce the information over and over again. Okay. Bigger children can be taught to cover their mouths when they're coughing. Of course, you know, when you have a sick child in the room, you need to open your windows wide so that you know, those particles don't stay in the air for too long. So those are the basic things that can be taught. But mostly, you know, these viral infections are not really preventable. If they do occur, these measures can be taken, but when they occur, they need to be, you know, dealt with quickly.
Okay. There's a question that has come, but let's take a short break. When we come back, we'll address this question from the nursing mother ambaye ameweza kututumia swali pale kwenye Facebook. Mtazamaji, kumbuka unaweza kupiga simu katika studio zetu uweze kuuliza swali la leo, tukizungumzia swala zima la infectious diseases kwa watoto na ni vipi tunaweza kuequip watoto wetu na skills ambazo wanaweza kutumia ili waweze kujiprevent from capturing or rather contracting these infectious diseases. See you in a short while. Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show.
Horizon TV, the beacon for the nation.
Healthy Thursday is not just about diseases. It's about food, lifestyle, milestones in the medical practitioner's field, especially in our Muslim Ummah, and more so, your health. Discover breakthroughs and milestones in the medical field. Learn how to manage diseases.
Oh, that was not painful.
Join the discussion. Make better decisions on your meal plans. Improve your lifestyle.
All the doctors who are there were tired of working in maternity and taking care of women. And they say, you are the new kid on the block. We are leaving this department to you.
Healthy Thursday is about you, about your family, your lifestyle. So keep it locked Horizon TV on Healthy Thursday with me, Mariam Mwacharo.
Horizon TV, the beacon for the nation.
Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Mwacharo. Unatizama The Sabah Show. Na mtazamaji, shukran sana kwa kuendelea kutegea the Premier Islamic TV station Horizon TV. Kumbuka unaweza kutupigia simu hapa studioni uweze kuuliza maswali ama ututumie message kwenye 21951 iliyoko kwenye screen yako kwa sasa, ama uweze kuchat nami pale kwenye Facebook yangu Mariam Kasim, ndio pale utanipata, ama uweze kuungana nasi kwenye social media platforms zetu Facebook, Instagram and Twitter is @Horizontv Kenya. We're talking about infectious diseases with Dr. Abdurrahman Hashi hapa. There is a question that has come in from one of the ladies, anasema I have 4 children and right now I am breastfeeding my last born. They do not have very big gaps between them, but ever since my first born they've always had infections every now and then. Kindly tell me what I may be doing wrong or what other techniques should I have to prevent these infections, kwa sababu nimechoka kutumia dawa za kukohoa. Okay, yeah, so I've asked daktari if you can respond to that. What can she do? What can she do different?
Well, if we look at her situation, of course we don't have enough information whether those children have been vaccinated, whether they have been exclusively breastfed for 2 years. We don't know all those things, and we don't know what type of infections she is talking about. But let me say this in general. she needs to do exclusive breastfeeding for 6 months. That is a protective mechanism, 1. 2, make sure that those children are breastfed for at least 2 years. They are well fed. They have good complementary feeding after 6 months, adequate complementary feeding after 6 months. Thirdly, they need to be vaccinated from birth all the way till 5 years, okay, or beyond, based on the gender and the condition. Now, at home, sometimes what happens is that some of those children probably are school going. They may not be getting the infections from home, but they might be transporting those infections from school to the household. See, that happens. So, things like hand washing, things like vaccinations and all those things, I think are going to help. She also needs to know that if it's a diarrhea, she doesn't need to worry. Most diarrhea in children less than 5 years is caused by viruses, and she can reinforce the hand washing and feed them well. When they are having diarrhea, they need to be hydrated well. Those children might not need to be seen by a doctor. If they're hydrated well when they're having diarrhea, they'll get better. Over some time, the viral infections are self-limiting and they'll go away. So, well, of course, after some time, the immunity will grow and they will become strong and they will be able to outgrow that. Unless there's any underlying immune problem where the immunity of the children is below normal, or they are missing certain agents of immune system, which is making them vulnerable for other infections. I think she'll be fine. Maybe
because here she responds and she says, "My children are only 8 or 9 months apart."
Oh yes. Okay.
So is this could this be a reason why? Because Daktari has talked about breastfeeding. Is that the reason why?
Most likely. We said breastfeeding. See, as an adult, you've gone through life. You have come across a lot of infections. You have developed immunity. When your newborn comes around, they may not be. The immunity is not good. So what happens is that you are transferring some of your immunity to these babies.
Yes.
They get a passive immunity from the parents. Okay, that is what's going to protect them from infections of the chest, the ears, the abdomen. So it seems like before she does exclusive breastfeeding for 6 months, she gets another pregnancy.
Child. Yes, possibly.
Yes, and that disrupts the breastfeeding period.
For the first child.
So that could be an issue. We have seen that practically, and it's evidence-based that breastfeeding exclusive for 6 months and thereafter for 2 years is quite protective.
Okay.
Yes.
Okay, so hilo ni jambo muhimu
sana. I hope she
sana.
also vaccinates her children.
Vaccinate, yeah?
Yeah. She follows the regular routine of vaccination.
Hopefully, dadangu pale uliweza kuuliza swali, daktari anasema he hopes that you're also vaccinating your children. Alafu possibly on this particular child ambaye right now you're breastfeeding, consider to breastfeed 6 months continuously and after that till 2 years, kwa sababu ile breastfeeding pia huwa inasaidia kumpatia mtoto immunity ya kutosha. Na wale wengine ambao wako now between 8 and 9 months, she probably needs to take them for checkup, right?
Yeah, absolutely.
Okay, Daktari, let's talk about eye infections. What are the common eye infections that we probably should be seeing in our children, and how can we prevent them?
Eye infections, most eye infections in children are viral, as we talked about. Of course, sometimes they can have bacterial. How do we protect? Wash hands. Infected hands, if you touch surfaces and you use that hand to touch your eyes, of course you'll get infected. Right?
So hand washing is like the main.
People don't understand that. They think it's a very simple. When we talk about breastfeeding, people think, okay, breastfeeding. What is with breastfeeding? There's a lot of importance in breastfeeding. There's a lot of importance in hand washing. That's the primary infection prevention technique.
Okay.
All right.
Yeah.
Of course, sometimes you get airborne infections of the nose and the throat, and then you use those secretions now, get into your eyes, or you touch your nose and you touch your eyes, and then you get infections that way. Well, there are different types of infections. You can get bacterial infections. You can get infections that involve the eyeball and the eyelids, and that could be a bit serious. So if you have eye infections, it's better to be checked. Usually they're viral, but sometimes you can have bacterial infections which are quite detrimental.
Question: if, say, for example, one child has an eye infection and the other one doesn't, can it be transferred?
Of course.
To another child?
Yes.
So now you should take this child. They should not play with the other children. Like what should you do?
You can't stop children from playing, but treat the child who is sick.
And proper hand washing techniques.
Definitely.
Okay. As we come to the end here, of course, maintaining good health and proper hand washing technique is also good. According to research, actually, hand washing prevents like 75 to 95% of bacteria. But say, for example, you're going out with your children and or children are outside. Some parents prefer to use disinfectants or, these napkins, wet napkins that are actually disinfected. Some of them are scented. Are these also effective?
Well, the recommended hand sanitizing agents are those that have alcohol, alcohol containing. And they should at least have 60% alcohol for them to be effective against germs.
Okay.
Now, the issue is this. These alcohol-based sanitizers are not better than water and soap, all right? Because the issue is that they cannot clean or remove chemicals from your hands, like pesticides, other chemicals that are harmful to your body.
Yeah.
So the best thing to do is wash your hands with water and soap. But if you can't get to use alcohol-based sanitizers, now for children, if you leave these hand sanitizers with children, there's a risk of them ingesting them, because you've seen they are in colorful bottles that have drawings of fruits and this and that.
Yes.
So if you keep them closer to children, the risk of ingestion and alcohol, poisoning is there. So they need to be kept away from children, but they can be used where soap and water is not available.
Okay. Okay, so and then there's also, according to some research, it says that some of these disinfectants, yes, they kill germs, 99%, whatever percentage, but they also kill some essential, bacteria that is important for your body. How true is that statement, Daktari?
That's true. Of course, there is bacteria on your skin that's protective. What is commonly known as normal flora.
Okay.
What that means is that bacteria inhabits your skin to compete against bad bacteria. Okay. So they watch over your skin. So of course, when you do constant rubbing of that alcohol on your skin, of course you lose some of this bacteria, and then that will make your skin vulnerable. But what has been associated with that more are the antibacterial soaps. Well, the question of antibacterial soaps is that some of them are not antibacterial.
Exactly. And okay, as you explained that, also there's a question here that is coming. Ask the good doctor, kuosha mikono na sabuni na maji, is it any kind of soap? Can we use Ushindi, for example, or we must use, the Dettol and the Lifebuoy, or any kind of soap is appropriate? So explain that, and then you come to answer this question.
Okay. Antibacterial soaps, as we said, some of them are not antibacterial. Some of these antibacterial soaps contain chemicals that are harmful. And these chemicals have been banned in some countries, including the USA. There is a recommendation from the American US Food and Drug Administration that has banned, of course, that has stopped the use of some of the chemicals that are put in these antibacterials, because they have been found, one, they're not useful. There's no information that they're useful, that they kill bacteria. 99% of bacteria, as has been said. Two, those bacteria, those chemicals are harmful, and some of them cause resistance to antibiotics.
Really?
Yes. Of course, they kill bacteria. Some of them can kill bacteria. But that makes that bacteria strong enough. Next time when you use an antibiotic, that antibiotic might not be useful. So those are concerns that have been raised against these antibacterial soaps.
Okay.
The best thing to do is use water and plain soap.
Plain soap.
Yes.
Okay.
We come back to the issue of now even destroying normal flora. That has been associated with antibacterial soaps. You don't need to kill bacteria that's useful, that's protective, using antibacterial soaps. That bacteria is protective.
And say, for example, Dr. you've mentioned that some soaps have, chemicals that harm and give even, resistance to antibiotics. What are some of these chemicals? Say if I'm going shopping and I'm a parent and I'm looking at an antibacterial soap, what should I look at so that I ward off from the product?
They talked about chemicals like triclosan and triclocarbon. Those are the ones that have been mentioned in the report by the American Food and Drug Association. And they have been banned in countries in America and Europe. But they are still around in our markets. I think that needs to be discussed.
Needs to change.
Yeah, definitely.
Yeah. And what about perfumed soap? Because you said yes, use plain soap.
Yeah.
But say, for example, if someone is using, the other kinds of soap that are perfumed and, they have, is that okay?
Well, some people might get some irritation from perfumed soaps based on their, the immunity and the allergic status. So somebody might have some allergy against some perfumes and might get irritation. It's usually good to use plain soaps. Perfumed soaps, well, if they do not cause any irritation in your skin, that's okay.
Then that's good enough to use.
That's okay.
Okay. Dr. we've come to the end completely. Give us your parting shots to the parents who actually requested for these particular episodes, just parting shots on infectious diseases and how to prevent them.
Well, as we said, we start from the beginning. We said we encourage exclusive breastfeeding. We encourage breastfeeding in 2 years. We encourage vaccination, timely vaccination. We encourage hand washing at home and at school and wherever the children are. If your child has an infection and you think your home remedies are not working, it's better to seek a medical advice so that it doesn't complicate and cause damage to the skin, to the body of the child.
Yeah.
So it's usually important that parents are aware of these infections. And there are certain infections that, as we said, that may not require, like common cold and mild diarrhea, that may not require a child to be seen by a doctor. Then what needs to be done is that they follow those remedies that we talked about to avoid any complications.
Okay, thank you very much Daktari, of course, for gracing our show, and thank you too for the viewers kwa kuweza kutuma maswali yenu na wale ambao wameweza kurequest hii particular episode. I can see the sister who talked about her 4 children. You've asked for the doctor's number so that you can go and see him. Inshallah we'll be sending it to you, na vile vile okay, sawa, inshallah we'll be sending the numbers to the people who requested for the doctor's number. We'll be sending them to you. Shukran sana kwa kuweza kutegea Healthy Thursday leo. Iwapo kuna maswali yote endelea kutuma katika line zetu, na vile vile pia unaweza kupiga simu, tutaweza kupokea hapo baadaye, tutaweza kukupatia majibu. Kwangu mimi ni maasalam kwa sasa, na ningependa kushukuru timu yangu yote iliweza kufanikisha kipindi hiki, kuanzia producer wangu Muhammad Shakombo, msaidizi wake pale Ibtisam Jamal, Saida Abud, our soundman pale alipoketi Nasir, na technical operators wetu kuanzia Bwana Hassan na Miss Sumeya na Biniamini. Shukran sana kwa kuweza kufanikisha kipindi hiki, na kwa kila mmoja aliweza kuchangia vile vile, na kutoka kwangu kwako wewe mtazamaji wetu ndio shukran zaidi kwa kuweza kutegea. Kwangu ni maasalam kwa sasa. Bismillahirrahmanirrahim. Amani juu yako mtazamaji. Wanakwetu wanatambua kama Mariam Wacharo. Unatizama The Sabah Show.
Goodbye.